we're going to move next to Dr. Chris Johnson. Dr. Johnson is the professor for the School of Public Health and Information Sciences at the University of Louisville and a health policy researcher. He's also the site director for the NSF Center for Health Organization Transformation. And he's going to talk about a very important component of this, and that's how we think about using it. Dr. Talbot referenced this a little bit in research, but also how it helps inform development of policy, which is another key aspect. So welcome, Dr. Johnson.
Thank you very much. And if you could go to the next slide, please. So here's the current problem. We are limited in our ability as researchers and policymakers to conduct comprehensive analyses about the ways that Kentuckians seek healthcare services and the impacts that legislative policies have on the healthiness of the Commonwealth. The databases on this slide exist in isolation, but none capture a comprehensive picture of all the ways that we need to understand the access, cost, and quality of healthcare services within the Commonwealth. Go to the next slide, please. How will an all-payer claims database fix this problem? Well, combining payer databases with other sources of information about healthcare access, cost, and quality will provide the first comprehensive data about Kentuckians' healthcare status, how they are seeking healthcare, the cost of that care, and its quality. This will allow policymakers to understand and examine a host of research questions that can lead to interventions that will improve the health of the Commonwealth. Here you see a broad but incomplete list of the types of questions that we will be able to answer with Kentucky's new all-payer claims database. Next slide, please. The good news is that all-payer claims databases are widely used within the United States. Our neighbors in Indiana and West Virginia have these already in place. APCDs have already shown value in the states that they have them across a number of different policy-related issues, research-related issues, and healthcare improvement planning within each state. These use case examples from other states are real impacts that APCDs are having across the nation. We are not reinventing the wheel here with an APCD in Kentucky. We are simply following the examples from other states about the effectiveness of these types of applications to improve the health of their citizens. Next slide, please. Price transparency is a big topic in health policy circles, and all-payer claims databases are valuable tools for states to both meet federal mandates about price transparency and to make it easier for consumers to understand what their treatments and pharmaceuticals costs. These are important issues that all legislative groups within states are worried about, and an APCD enables the policymakers, researchers, those that are interested in understanding what the actual costs and prices are within the healthcare delivery system. An APCD will greatly assist with this area. Next slide, please. Here we see how APCDs can be used to fight numerous public health problems that we face in the Commonwealth. One of the main advantages of the APCD is that it contains the data necessary to devise coordinated interagency interventions for critical services in a timely manner. Currently, that's very difficult to accomplish within the data structures that exist within the Commonwealth. But with an APCD, we will be able to identify these sorts of public health problems, create interventions or put together teams to investigate the causes of these problems, and then help local areas, the state, counties to understand and design effective interventions that will positively impact the quality of life for people in Kentucky. Next slide, please. Here are some additional examples of the potential of an APCD to address multiple stakeholder concerns about the healthcare delivered in our Commonwealth. It is somewhat overwhelming that in the absence of an APCD, these types of questions and concerns are difficult for researchers and policymakers to answer, despite these being sort of fundamental questions about how healthcare works or doesn't work in Kentucky. We cannot answer many of these things with the current database structure, and an APCD will assist us into better being able to understand how healthcare is delivered, how healthcare impacts the access to services, its cost, and its quality. Next slide, please. This is one example from Massachusetts of a consumer website that's used by consumers within Massachusetts, state of Massachusetts, to make decisions about what healthcare plans they want to join, the costs of services that they potentially may have to interact with within the healthcare delivery system. And it's based on their APCD that's in Massachusetts. So you're able to, as a consumer, compare the cost of an MRI or to see which health system ranks higher on the kind of services that you need to get within the hospital or healthcare setting. So it's a valuable tool for the citizens of Massachusetts, and other states have similar types of consumer websites for folks within their states. And we believe that the people of Kentucky deserve a similar kind of ability to compare costs and to make care decisions. And I will stop there and hand it off to the next presenter.